I know you and I are so excited to kick off this series because, sister, we're all going through unprecedented times.
Unprecedented.
It's a lot. And you and I, especially when we talk on the phone and we feel our feelings, the first thing we always say is thank God for our sisters and brothers on the front lines at these hospitals and the doctor's office, the emergency rooms, the paramedics. They are saving our lives, our families' lives, and risking their own every day.
Every day. Two of my best friends are in the medical field. Jillian's godmother is a registered RN, and one of my first roommate at Hampton is a doctor. So I constantly in our group chats where I'm always saying, how are you two doing? Like everybody else is good, but how are you two doing? Because they, like you said, they're there dealing with this and helping us all get better. But I think you found us one of the best doctors on the front line right now, Charlie.
Seriously. So one of the things I do all day long is just scroll Twitter looking for Black doctors talking to the community because, we trust them more and they're out there, they're on the front lines. And we discovered Dr. Uché Blackstock, who is a phenomenal woman. She's the founder of Advancing Health Equity and a board certified emergency medicine physician, Harvard Medical School, y'all. And not only is she practicing in the ER right now, okay, and saving lives, she's also then on Twitter giving people personal advice about the medical situations they have going on in their families, personalized advice. And she's a mom herself. Welcome, Dr. Blackstock. And we already are just like, sister, thank you.
First, let's just say yes. Thank you. First and foremost, thank you so much. Thank you for everything that you do.
Thank you for having me. Excited to be here.
The reason we are doing this series is because it's Mother's Day. And every year, we celebrate moms for being incredible moms. But you and moms like you right now aren't just being mothers in your own family. You're taking care of our family, the world. Mm-hmm. There isn't enough gratitude to throw your way. I don't even know where we begin. But we have to say thank you. And just what has that been like for you? What's a typical day right now in the pandemic like for you?
Yeah.
In who you are?
Yeah, I mean, definitely, as you mentioned earlier, we are in unprecedented times. And, I've been practicing for almost 15 years and I've never had this experience before. And even some of my colleagues who've been practicing for 35 years, they also agree, we've never seen anything like this. Just the level of sickness in people, the number of patients coming in, sort of just overwhelming the system, really. And us just trying to do our best to care for them and do right by them and their families.
Now, did you always want to be a doctor? I mean, because I heard that you're a twin.
Yeah, the interesting story is that our mom was a physician. And so our mom is the original Dr. Blackstock. And so she was the first in her family to finish college. She actually had a professor at Brooklyn College, chemistry professor, who encouraged her to apply to medical school. She did. She got into all of her medical schools. She went to Harvard Med School. And so we are actually the first Black mother-daughter legacy from Harvard Medical School. Our mom came back to Brooklyn, New York, where she was raised and practiced here for many, many years. And we lost her when we were 19 years old. We were sophomores at Harvard undergrad, and we lost her to leukemia. She was only 47 years old, but she's obviously made a huge, huge impact on us. So that's why this is even more special that this is for Mother's Day, because when you talk to my sister, she will tell you our mother was the most amazing mother. So even though we only had her for 19 years, we were blessed, absolutely blessed for 19 years. When people meet us, they meet her essence, her positivity, her commitment to the community. They meet all of that when they meet us.
Oh my gosh, she
sounds amazing. The best of her is in you both. The best of her.
Yes, absolutely, absolutely. We miss her terribly. But we learn how to be mothers from her, right? So we learn from the best. So we try to be good mothers to our kids. Even though we have different types of stress today, especially in this pandemic. This is as I mentioned, something that we've never seen before.
What did she teach you about being a doctor or being a good doctor?
So that's such a great question. And one thing that she taught me was that this work that we do, it has to come from the heart. It has to be a calling, because we know the journey of being a physician is not an easy one, starting all the way in college when you're pre-med. And so you commit a lot of time and energy and effort to that whole process of becoming a physician. And so you really have to be all in. It can't be something that you're only half in. Like, I think I kind of want to do this. Your heart has to be in it. And then to have the honor and privilege of caring for people, right? And people's family members, that's something that we have to take very seriously. And that's what I learned from my mom. But I also learned from her that as a mother, you have to take care of yourself first, right? And that's how you can be the best mother, the best partner, the best physician. So even when I was a little girl, she would say, you have to make time to meditate, make time to get a massage, make time to get your nails done, just make time to be grounded. Even when we were like 11, 12 years old, she would tell us this. At the time, I didn't know what she was talking about. Now I get it.
How are you finding time to do that now with everything that's happening?
Seriously, I mean, self-care.
I know. I was telling someone recently, I feel like I'm back in kind of maternity leave or when my kids were really small, because it's hard to get things done during the day. So I'm either I'm up early or I'm up after they go to bed. And that's when I have the time. So I get up early. I try to work out every morning, whether it's doing exercises at home or I go for a run, because I picked up running again since the gyms are closed. And then in the evenings, I'll try to read a book, watch a favorite television show, or do some meditation just when I have some time to myself. So that's when I've been trying to make the most of this crazy new abnormal that we're in. And it's challenging. It's not, I think it's going to take a while to kind of figure out, to get into a routine. But I'm doing my best.
Right now, I know, like you said, in the ER, it's just, you have a lot of patients. Our community is disproportionately suffering, right? Let's be honest. And you being a mother and a nurturer and also an ER physician, that must be so emotionally taxing. What has that been like for you?
Yeah, it is. And I understand this is a scary time. I'm scared. I've never been scared to go to work before. I'm scared because I'm scared of contracting the virus. I'm scared of bringing it home to my family. So I understand my patients' fears, whether they come in and they actually have it or they don't. And so I found that I'm spending a lot of time counseling people, educating people, and having to remind myself that patients now, they need a little bit of extra time. Even though we're super stressed and we have a lot of patients to see, that sometimes they just need to be reassured. And so I've been trying to do that. And that can be draining too, because when you're comforting everybody, but you also need comforting yourself, where does that leave you? And so I feel like I've been blessed that I have a lot of loved ones who've been checking in on me. I even get, every now and then, I've been getting care packages from people. I don't even know who they are.
That's beautiful.
Yes. So it's nice because I've always been in that position of being the carer, being the nurturer, being the person who is always looking out for other people. And so, and I sometimes have had a hard time to telling people what I need, but I've been trying to do that more often, because really you can't really expect other people to know what you need. They may have an idea, but sometimes you have to tell people how they should help manage you or help support you.
Oh yes, you have to tell people how to treat you in every situation.
Yeah, and that's even like your partner, your close family members, anyone that means anything to you. You have to tell them, or even like my father, sometimes I have to tell him, that's not really what I want to hear right now. You know what I mean?
Yeah.
Right now,
my father too.
Yeah, right now, I just need you just to listen, right?
Yeah. No.
I need to feel my feelings, Corey, and I always say that.
Exactly. Yes. Mm-hmm.
So, Dr. Blackstock, one of the reasons you came on our radar is because you posted something that was really beautiful, and I want to read it back to you. You said, I'm beginning to see some signs of hope. Waiting rooms are less full, fewer sick patients. I was able to take a breath today, literally and figuratively, at my workstation because our patient volumes are down. I spent more time with patients and felt less rushed like it used to be. So what was happening when you were posting this, and how are things going right now?
Yeah, so it's interesting because, I'm here in New York City. It's the epicenter of the pandemic. So we reached our peak in terms of number of cases much earlier than the rest of the country. And so what we're seeing is that, our shelter in place orders, all that is working. And so we're seeing fewer cases. And so definitely where I am, I had a chance to literally our volume like cut in half in terms of the number of patients we were seeing. And so I actually had a chance to breathe and to not rush when I saw patients because I wasn't seeing so many of them. And it really just gave me an opportunity to reflect. So on the other side, though, what we're seeing, though, is that a lot of the patients that were admitted to the hospital and have been on ventilators in the ICU are now passing away. And I just found out this morning about two of my colleagues. One was a charge nurse who's been working in our ER for 30 years, where I trained in Brooklyn. And then another was an ICU doctor, also practicing for more than 30 years, committed to the community. Both contracted COVID-19 and passed away. So, while there is hope, there also are days where that are very, very painful. But I'm hoping that in the long run, we'll see more of those hopeful days on the horizon for us.
Why is it disproportionately affecting our community so much? You being a Black woman and an ER physician, being on the front line, seeing it. Can you be as specific as possible? Why us?
Sure, and a lot of different reasons, but the one phrase is structural racism. We've had practices and policies in this country that have left our communities, Black communities, the most vulnerable. So we carry the highest chronic disease burden. We have asthma, diabetes, high blood pressure. These are all medical problems that actually predispose us to suffering the more serious complications of COVID-19. We are more likely to be essential workers. So we're more likely to still have to work. We're on the front lines, so to speak, right? We're exposed to the public. We're exposed to opportunities to contract the virus. And then, the hospitals in our areas are not necessarily always resourced well or equipped to take care of us the best way that we can. And finally, there's provider bias. So we know that there is what we call implicit bias, which is not something that is benign or is insignificant. We know that it has been implicated in healthcare disparities, but we see that physicians, clinicians routinely prefer and listen to white patients over Black patients, right? And so when you put all of those factors together, this pandemic is almost the perfect storm for our communities being absolutely devastated by this virus.
How can we be better advocates right now for ourselves? I saw that you tweeted to DeRay about, if someone has asthma, their blood level, their blood oxygen level needs to be maybe checked before the shortness of breath.
Right.
That we can do.
Yeah, no, so what I will say is this, that there are immense structural barriers that are preventing our communities from reaching our highest health potential, right? And so those are barriers that government officials, public health officials need to deal with. And in terms of what we can do as individuals is educate ourselves as much as possible about this virus. Realize that these social media memes that we've been seeing about 5G causing this. I don't know if you've heard about 5G cell phone signal has been implicated in this. Knowing that really it is our communities that are going to be the ones that are most harshly impacted. So while this idea of physical distancing for some people is very easy, and maybe in our areas, many of us are living together, we can try just to do our best, washing our hands, wearing masks at home. I do know a lot of community-based organizations are trying to help get the message out in terms of education and outreach to our communities and trying to go door to door. But I will say the burden is on government and public health officials to make sure that our communities are receiving the best outreach and care possible.
So I hate to go back there, but when you think about the losses, I mean, how do you process the losses while fighting an ongoing battle with such bravery? Where do you source that from?
I don't know. It's somewhere in here. I do think that there is some part of medical training where, you have the goal is just to take care of your patients, right? And so you try to keep doing your best. And so even before this, when, I would be in the emergency department and we had someone come in and they're in cardiac arrest, their heart stopped, right? We're with them for an hour. They may not make it. We're doing CPR, we're giving them epinephrine. And then after that, I still have 5 or 6 other patients I have to see after that, right? And so you almost learn how to compartmentalize. I'm not saying that that's a good thing, but it is necessary to keep doing your job. But one thing that we've been talking more about in the physician space is really this idea of that taking away the stigma away from being able to talk about these these painful experiences that you have with your patients and normalizing that, because that's so important to helping us deal with the crisis that we're going through right now.
Absolutely. And being that you had such an incredible mother who really helped shape your path and your sisters, I know, mothers and daughters have incredible conversations. What's something that you learned from your mother that you take with you and hold with you every day that has shaped the woman that you are?
Oh, that's such a great question. We had so many really wonderful conversations. And even when she was sick and we knew that we were going to lose her, one thing that she did tell me is that she told me that when you have children, do not treat your sons and daughters differently. You have the same expectations for them. Love them the same. Don't think that boys can do certain things that girls can't do. And so she said, just love up on your children. And so for me, the work that I do it for my kids, not just taking care of patients, but my organization, Advancing Health Equity, to address healthcare disparities. Is really to make a better world for my children. So that's one way that I show my love for them, by doing this work.
That's beautiful.
That is beautiful. That is the perfect way to do it. I try to do that. I mean, I only have one daughter, but I try to be mindful of not saying like, oh, that's it's a girl color, that's a girl toy.
Right.
Like, it's funny, as much as I do this work, I still have like this old school mentality sometimes, but it's a conversation you must have.
And it's hard not to, because that's how we're socialized, right? But I think that we're in a different time now where we can let our children be themselves in a lot of different ways.
Yeah. It almost helps that her dad is constantly like, she's in too much pink. She's in too much pink. And I'm like, that's right. It is too much. Get some brown in there. Let's get some navy. I'm sorry, Charlie, you were going to say something.
No, Dr. Blackstock, I'm curious, with your mother having been a doctor, you and your sister being doctors, would you want your children to also go into medicine? Or
do you really want to know the answer?
I do. Okay. It's legacy, right?
So fully transparent. I would be, if they wanted to do something like very creative, I would be very excited. I really would be. I think that, being a physician now, it's very different than being a physician 20, 30 years ago, because of insurance companies, because of paperwork, because of this pressure to see patients very quickly. It's really taken away a lot of the personal feel out of it. And so while I think you can do wonderful things as a physician, there are a lot of other jobs that you can have in your life where you can help other people. So that's what I will say. And I also miss being able to use my creativity, which is actually one reason why I started my company, because sometimes, going to work as a physician, you don't always get to use your creativity. And so that's why I say if my kids wanted to be a writer or an artist, I would fully support them. As long as they can support themselves, that's all that matters, and they're happy.
I get that. And thank you for your honesty, because I'm sure a lot of doctors get that question.
Before we wrap up, Dr. Blackstock, I want to ask you, because Charlie and I, as we've been developing this series, we've been also hit with the idea of like it's kind of like we mentioned, like some people think it's like, 5G signals or whatever. What do you say to people, especially our community, who are still in doubt that this is happening, that this virus can infect you? And if you're not careful, and if you're not able to take care of yourself or can get the proper treatment, you could die. What do you say to people who are still believing this is a conspiracy
Right.
or this is a hoax or this
Just
is
like
just,
the flu.
or the,
Right,
or the
right.
government,
No.
whatever.
Well, yeah. Well, I'll tell them it's about 20 times worse than the flu, if that. And I'll also tell them I've never seen in 15 years what I'm seeing right now in terms of how sick patients are getting with this virus. And that also it's impacting our communities the most. Like if you look at the numbers coming out of almost every major city with a sizable Black population, it's disproportionately affecting us. And so these cases and the deaths that we're seeing are very, very real. And that's what I really try to communicate on my social media, on Twitter, because I really try to speak to our people and our communities about this because we're the ones that are being most significantly impacted by COVID-19.
And lastly, I think what we're all constantly checking, right, Corey, Twitter for and everything is like, we want information, but we also want hope.
Yeah.
So do you have a message of hope or
Yes.
positivity for all of us out here who are staying home, but a little anxious and trying to do our part, but not necessarily feeling like it's working fast enough?
No, absolutely. I mean, we're seeing in New York already, our numbers are going down in terms of cases. And so staying home is saving lives. And so while it may not seem like it's working now, wherever you are, whatever city you are in right now, that in the long term, it's going to work. So while it may be a little bit painful for a few weeks to months, that it's all going to be worth it in the end.
Dr. Blackstock, thank you so much. From our heart to you and every mom like you right now, literally on the front lines. We love you, we appreciate you, and we cannot thank you enough.
Thank you for having me.
For us.
Thank you.
Thank you so much.
As we continue our conversation about our sheroes on the front line, Black moms on the front line, I know you and I have been thinking a lot about the immunocompromised community.
Yes. I think you were telling me before as we were prepping for this interview with this amazing doctor we're about to talk to, that they are some of the most compromised people right now dealing with if they are infected with COVID-19.
And try not to catch coronavirus. You know, if there's autoimmune disorders, people who are HIV positive, people who have AIDS, they're really scared. And we are saluting the doctors on the front lines and the moms on the front lines who are taking care of them, which leads me to today's guest, Dr. Oni Blackstock, MD. She is the Assistant Commissioner at the Bureau of HIV at the New York City Health Department. Dr. Oni, good morning. How are you?
Good morning. Hi, Charlie. Hi, Corey. Thanks for having me.
No, thank you for taking time out, because I know right now, well, we know that time is very precious to you and the work that you do.
Yes, it is hectic. It's very busy right now, but I appreciate the time to have community with the two of you.
And we've been opening these conversations with this straight up thank you so much. Being on the front lines, taking care of our families and your own, there isn't enough gratitude that we could offer.
Thank you. You're very welcome. I think it's a privilege to do the type of work that I do, and I'm also part of the health department's, New York City Health Department's response to the pandemic. So a lot of my time has been devoted to that.
And we've been hit the hardest here, right, Corey? I mean, New York is just the epicenter still.
Yes, no, totally. We've been, impacted in ways that we never imagined. And so it's been really a privilege and very exciting and scary sometimes, also just to be part of this large response to taking care of our city and protecting New Yorkers.
Now, Dr. Blackstock, your job sounds really huge and really complicated. So for our listeners, can you talk a little bit about what that means in your day-to-day and how has it changed since the pandemic?
Okay, so I'm a primary care doctor. So that means I take care of adults. I'm an HIV specialist, so many of my patients are living with HIV. I see patients once a week at Harlem Hospital's HIV clinic. And then I spend the rest of my days at the New York City Health Department, where I oversee the Bureau of HIV, and we're responsible for the city's response to ending the HIV epidemic. So we do a lot of stuff.
Good job.
A lot of stuff. One of the main things we do is support a lot of different clinics and community-based organizations in providing HIV prevention and treatment services to New Yorkers throughout the city.
How has your day-to-day changed with the pandemic? Because I imagine that community being most at risk, it has to take a lot of precautions.
So clinic-wise, I've been really fortunate because I've been able to do televisits with all my patients, and I check in on them. I say, how are you doing? And we see if they need any refills. The main thing is making sure that people, stay home if they can. And, for my patients who are living with HIV, really weighing like the risks and benefits, like, is it worthwhile to come out and get your labs checked? Or can this wait? Can we hold up another month or two and see how things go? So I'm always sort of thinking about them and making sure that they stay protected. One thing that was really sweet, one of my patients who has been through so much over the past year, he called me and was like, I just want to check in and see how you're doing. And I was like, thank you so much. And this man had been through so much. But I think we had developed such a rapport. He was like, I just want to make sure you're okay and staying safe. And I really appreciated that. My work at the New York City Health Department, usually I am in meetings all day. And actually some of my work has shifted to working to address the COVID pandemic. So we have our full-time jobs in the health department, and then we get activated, which means that we also then have to be part of our health department's response. And so the work I'm doing is focused on guidance to congregate settings like homeless shelters, supportive housing, and what those types of settings can do to keep their residents safe if there is an outbreak, if someone becomes sick. So that's some of the work that I'm involved in.
And these are the communities our hearts have been going out to the most, the homeless community as well.
Yes.
How can you stay at home when you don't have a home? I mean,
exactly.
I keep saying that, and I'm just...
And wash your hands and do all the things that are very basic, but to your point, Charlie, when you don't have a home.
Exactly. No, I think, right, it's just sort of like peeling the layers off what this pandemic has done. And so those people in communities that are already very vulnerable are made even more vulnerable by what's going on.
Now, this work that you do, like I said before, is really big. So what was the moment that you knew this specific kind of job is what was in your soul to do, in your spirit?
Yeah, so this will probably sound similar to my sister, Uché. But, my mother played, a huge role in just my life and my career path. And so I'm sure she also shared with you, our mom was, grew up on welfare, in substantial poverty, did not have a lot of supports the way that we had. And she had a really wonderful professor in college who encouraged her and a number of other minority students to apply to medical school. And then she ended up going to Harvard Medical School and becoming a nephrologist and geriatrician, and spending most of her career in central Brooklyn. And so growing up, my sister and I would, go visit her at work. We just hang out. We just see how much she really enjoyed what she did. And I think also seeing the way in which she married medicine to community service and social justice. So just seeing the way that those intersected and the way that as physicians we can be advocates for our communities was really important. I think she really exemplified that. So sort of, I don't actually, our mom died when we were in college, but she did leave a note for us saying, and my sister may have mentioned that, she left a note under her mattress, which we found. She died when we were in college. And the note said, take care of each other, take care of your father. And she's like, and please make sure you go to medical school. So we couldn't disappoint her. So we went on to medical school, and I actually spent the last 10 years before I joined the health department 2.5 years ago doing academic research, which is applying for a lot of different grants, applying to the CDC, National Institutes of Health. And that was really exciting. But it's also really challenging because your livelihood is really dependent on whether you get these grants or not. And then literally got an email from a friend of mine who was like, Oni, you need to apply for this job at the New York City Health Department. They need people like you in this role. And I was like, no, I'm not. These are all the reasons I'm not qualified. And she was like, girl, apply.
Yeah.
Right. And so I applied and then made it through all these different rounds of interviews, and ultimately was being interviewed by the Commissioner of Health, and got the position. It's been a very rewarding job. It's also been really challenging working for government in lots of different ways, but everyone who's there is really committed to the well-being of New Yorkers. So that's been really, really wonderful.
Thinking about the letter from your mom, chills, because you know, you said take care of each other, take care of your father, be a doctor. And now here we are in 2020 and you're helping to take care of the world. Part of that must, what does that whole sort of 360 moment feel like for you
and you're a mom as well.
Yes, I'm a mom.
Family.
Yes, I'm a mom. I have a 7-year-old. And he splits his time back and forth between myself and his dad's place, my place and his dad's place. So 1 week. So 1 week when he's with me, it's like really intense, and I'm trying to like juggle everything and do the crisis homeschooling and be on these calls. And then when he's at his dad's, I get to do things like this. It's wonderful to come full circle. I do think though, like as much of a privilege as it is to be a physician, I am looking to I'm thinking about the next chapter of my life. And I think this pandemic for a lot of people has allowed time for some reflection if we're fortunate and have the privilege to do so. And so I'm thinking about, what really nourishes me, what am I really excited about, and where can I be in a role where I get to kind of do what I want to do and sort of speak on things that I want to speak on and not have so many constraints.
I'm thinking about just jumping to your active Twitter, social media, and I love that you're constantly putting out advice. And one thing that you put out is how to, and let me jump into Charlie's shoes right now because she is our love guru.
Yeah.
But people are concerned about having sex now during this time, during when this disease is going around or a virus is going around that's highly spreadable. What do you say to people who are, looking to scratch an itch, I guess?
Yeah, no, it's totally part of being human beings. And we know sexual health is a really important aspect of overall health. So we want to make sure that people are able to do that in a way that is safe for them and safe for the community. So we were getting a lot of questions around sex and in the age of COVID-19 from community members. And, our team put out this guidance that literally went viral, no pun intended. And really just saying that, first and foremost, you are your safest sex partner. And then after that, a consenting adult who lives with you. And then if you're going to have sex with people outside of your household, really try to limit the number. And it's really about just making sure, the more people you have, the more potential risk there is to pass something on to someone else. And we said, kissing, it obviously really easily spreads COVID-19, the other types of sexual activity that can spread COVID-19. And just because it's just the closeness that people get when they are being intimate. So we really encourage folks to think about virtual platforms where they and their partners can stay safe, like video chats, sexting, things like that. I know I was just on a IG Live last night about this, and I know someone was talking about all these amazing virtual dates that they've had during this time.
Okay.
And we're saying that they've been having these really long, interesting conversations. This was a woman who was talking about guys that she was dating, and she was like, these men can talk and they can have good conversation. It may take a pandemic, but they can they can really engage.
Out the physical intimacy off the table.
Right. Emotional intimacy. Right. No, exactly. And get that deep conversation going. So yeah, we're all for it, and we're all for people doing it in the way that's as safe as possible.
Well, we love seeing, like Corey's saying, we love seeing doctors like you and your sister using Twitter as a tool to get information to the community because we're all so hungry for it. So thank you for that, first and foremost.
Yes. And I think it's so interesting. I think people talk about Black Twitter and just being sort of the voice of Black America and how powerful it is and how it can amplify. And I think as Black women, sometimes there are a lot of different forces that are trying to keep us in place, and so that our voices can't be heard. And I think for my sister and myself, we've sort of found, oh wow, Twitter really allows us to get our thoughts out there. So it's interesting. I get a lot of inquiries from Twitter, not from, you know what I mean? Because that's really the place where I'm able to share what my thoughts are really, really widely. So that's been really exciting.
And I say that because we're listening to doctors right now more than ever, in the time where we were following celebrities and all of that. And now it's what are the doctors saying? And in that vein, what advice do you have to someone who may be HIV positive, who's at home, scared, trying to stay healthy and safe and avoid getting COVID-19? What would you say to that part of the immunocompromised people in general in the Black community? What's your message?
Yeah, so obviously this is a time of a lot of uncertainty, and we're learning a lot about the virus. And so I know among people living with HIV, you've gotten a lot of questions about whether having HIV in and of itself puts people at greater risk for getting COVID-19 and having like severe complications from it. And so we actually don't know yet whether HIV itself is a risk factor, but we do know that when people do have weakened immune systems, so most people living with HIV are actually doing really well, as long as people are taking their medications and they have the support they need. Some folks who may be struggling might not be able to take their medications as prescribed, and so might have more weakened immune systems. And so we just tell it, just really for everyone to try to, if you have a home, a safe home and warm home and clean home to stay in, stay there, shelter in place, and really only go out for essential items. Even for telehealth, if you can take advantage of that with your medical provider to do that. Hand hygiene for everyone, and also making sure that you have an adequate supply of medication. So here in New York State, our Medicaid and AIDS Drugs Assistance Program has allowed people to get like 60 to 90 days of medication, which is really great. So people don't have to go out every month to get their medication, or see if your pharmacy has home delivery, so that you don't have to go outside. But we're hoping to get more information about the intersection of COVID-19 and HIV so that we can keep folks who are living with HIV and the people who take care of them as informed as possible.
Dr. Oni, when you're talking about things, I'm thinking like you have such a burden. So what do you do when you're able to log off the computer?
Yeah.
I know you're working from home and, when you have to you have a lot of meetings, but how do you like disconnect from the weight of the world?
So it's so interesting the way the universe works. Before all this started here in the United States, I had actually started making a commitment to myself to meditate every day. So I do this Liberate app. I don't know if you all have heard of it. It's for Black, Indigenous people of color. It's amazing. It's really great. Lots of different people of color, they're Black folk, and a lot of their guided meditations. I also find it like really hard just to meditate when there's like complete silence, but they're guided meditations on a range of topics. It could be from mindfulness to microaggressions. And then there are also talks. And interesting, from that app, I learned about this Buddhist Lama teacher, this Black queer guy named Lama Rod Owens. And on his Instagram, every day, he does a 15-minute short, it's called the Dharma Talk, where he'll talk on a topic, loneliness, compassion, whatever it is, and then he'll do a meditation. So I always do his meditations every day. I do yoga every day, like 20, 25 minutes off of YouTube. And I've just been doing a lot of sort of reading and trying to ground myself and stay present, because there is so much uncertainty. We don't know what the future holds. And it's so funny, we always think that we can, people are like, oh no, I was planning to do this and I was supposed to do that. But like, no, all of that was uncertain too. Like we have no control over the future. We only know about now and the present moment. And so have just been really trying to center myself and ground myself, and now using some of those contemplative practices and movement practices.
I love that you found a way to find peace in all the chaos, and that's beautiful. What advice do you have to other moms on the front line?
Lama Rod Owens is really great. He shared this quote. The basic idea is it's drink as you pour. So like, before you can fill up somebody's cup, you need to make sure that your cup is full. So even if it means, and this can be hard, waking up a little bit earlier before your little one, then that's what I do, because I'm like, I don't want him interrupting my meditation. So I'll be like, I know what time he usually wakes up. So I'll like try to wake up like 15 minutes beforehand so I can just have some of that quiet time. So just where you can, and I know it may not be possible every day, but even taking like a minute to like deep breathe, or even 3 breaths, can help ground you. Or if you're standing, just feeling the ground beneath you and the way that earth supports you and how connected we are to the earth, and just remembering that we're always supported and loved. Just trying to just squeeze in some of those little things, I think can make a big difference. Because when you are in those periods of like feeling really stressed and overwhelmed, you can like go back to those practices.
Wow. Before we leave with you, because you've been giving us so much, we want to talk a little bit more about what is your advice to those people in marginalized communities who are trying to advocate for themselves with limited resources and information. What do you say to them?
I think about this a lot when Black people in particular, when we have to go to a medical provider, and we hear a lot about, people showing up with symptoms of COVID-19 and not being able to get tested or whatever it is. So I think, particularly for folks who are going to see a healthcare provider, if you can like write down bullets, like everything that whatever you're experiencing, how long it's been, just like a lot of details and specificity, so you can have that really at the ready. Also bringing like a peer or a family member or someone with you who can also advocate for you is really important. And then if you're also like seeking care and you're unhappy with the care you're getting, you can try to see another provider. Hopefully you're not stuck with that one provider, and to really consider getting second opinions. And I think as Black people, as a community, we've always relied on each other. Like we are, I think sort of the dominant culture is a very individualistic culture, but our cultures have always been relational cultures where we really rely on each other and community. So as much as people are feeling isolated now, to remember to the extent that you can, stay connected. And if you aren't hearing from folks, reach out to them. It's so important during these times. So just relying on those networks and supports that we have always had, but probably need more so now.
I have to say, you and your sister have such a calming and relaxing presence, right, Corey?
Yes, you both do.
And I appreciate that. And it makes me I want to ask you, how do you manage fear? Because I think a lot of us are feeling more fear than we've ever felt before. And most of us don't have to go out and see patients or, be on the front line, and help others. How do you manage fear and process fear and get back to the place that you're at? Because I think we all need to learn how to do that, whether we're on the front line or not, but you all have to do it every day.
No, it is really hard. I think it's so funny. Just to say that I have like experienced and suffered from like anxiety and depression. So just to say, and these things are not me, but they're things that I've experienced. And I have to say, meditation and mindfulness has been really, really important to keeping me grounded. And because I think the fear is of like the anticipation of what could happen, but there are a million different possibilities, right? Of what could happen. Like we never knew that our future held a pandemic, or maybe some of us did, but many of us did not. So again, just trying to stay in the present moment has helped me to not think about and get caught up in, oh no, what does the future hold, and all of that uncertainty. And I think just doing what you can do, that's within your control. Like I was talking to my sister, because I know she sees patients several days a week at her urgent care center. And I said, there's only you can only do what you can do. You can put on your PPE, do your hand hygiene. Those are the things that you have control over. I think you've seen like those memes, like this is like your sphere of control. These are things you can control, like trying to keep yourself safe, doing all your hand hygiene, social distancing. And then there's there are tons of other things that we have no control of and have to like be okay.
Thank you so much for that.
Oh,
what are some things you've been teaching your son during this time? Like, how is he managing?
I know. It's so funny because he's in first grade and he's so cute. He has always thought school was boring. He's like, Mommy, school is so boring. And I'm like, it might be, but you still got to go. Yeah. But one thing that I have worked on with is just so in finding self-compassion for myself, extending compassion to him. So like when he's melting down and is having a hard time, or he actually finds all the Zoom sessions really boring with his class, before I'd be like, you need to get in that chair. I'd be like that. I was like, get in that chair. And now I'm just like, I get it. It's like super boring. It's not the same as being with your friends. Mm-hmm. And I was like, okay, just do what you want to do. And I'll literally like, I need to go do my work. You decide what you want to do. And I understand it's really hard. And he like will eventually like come to the chair and sit down and participate, whatever. But I just tried to like, just remember, like he's just 7 years old. He is going through something that's, unimaginable, like all of our children are dealing with. And to extend compassion to him and to understand what it must be like to be a 7-year-old, to be a first grader, not able to go to school or see your friends. So I think that has helped a lot. And he was having a tantrum the other day, and I think if it had been before this, I would have been like, what is your problem? What is wrong? And I just like held him and I said, I know you feel really frustrated. I know you feel really frustrated. You feel really angry. And I like literally held him and we just were deep breathing together. And he was like, he calmed down and he ran off to play. He was like, fine. So I just think sometimes like it's just finding like sort of the deep wells inside of you. Like, okay, once your cup is full, then you can take care of other people better.
I love that you're sharing that because I too have I have a 10-year-old,
yes.
But we do have to really be mindful of how they're processing things.
Yes.
Like as I'm not saying we do this. I mean, I understand you telling us that you meditate. I drink wine.
Yes,
probably have birthday. So we have a way to kind of decompress. But for kids, they may not know what to grab onto right away. That will just make them feel certain or calm,
Exactly. And the thing is, and I think we can also learn from them too, because they actually are the best at staying in the current moment, in the present. They're not, most of the time they're not worrying about what's happening next week or 2 weeks from now. I think as they get older, they probably get more of that worry, but they're like just playing. When they're playing with their toys, they're just thinking about their toys, not thinking about anything else. What am I going to eat later? Whatever. So I try to I actually have like a renewed sort of sense of amazement or awe for my child, because I'm like, oh my goodness, they're like things I can learn from him too.
Yeah. My daughter constantly is telling me, when are you going to take a day off? Because I feel like since we've been working from home, and I talk about I feel like I work every day.
Yes.
And she's the one that says, when can you take a day off? And I was like, you know what, she's right. When I do need to just take it down. So what I do now, I mean, this is something small. I literally shut down the computers opposed to like leaving it idle, so I can easily, so for me to log back in takes like a lot of steps.
Yes.
So I'm like, no, I'm shutting down today. Right.
Exactly. No, that's so true. And I should just say, when he left last week to stay with his dad for a week, I did an order on Drizzly of wine. Hello. So literally he left and the wine arrived. So I'm with you on the wine.
Yeah. Dr. Oni, we can't thank you enough for your time, your wisdom, and for the work that you are doing every day. So from our hearts to yours, thank you. We appreciate you. You are our hero.
Thank you. Thank you so much. It's such a pleasure speaking to you both.